Have you ever noticed that you breathe through one nostril more than the other? Maybe you've noticed that your breathing has changed because of a stuffy nose or allergies. You might be wondering, is this normal, or is it a sign of something serious? If it's a result of a stuffy nose due to allergies or a cold, it's generally not a cause for concern. It occurs when the septum, which is the structure that divides the two nostrils, is misaligned, causing one nostril to become blocked or obstructed. This can make it difficult to breathe through your nose, and you may find yourself breathing through your mouth or only through the unobstructed nostril. A deviated septum can be caused by a traumatic injury to the nose, or, in some cases, it can be genetic. It's important to first identify the underlying cause of your nostril breathing before seeking medical attention. However, if you're experiencing difficulty breathing, persistent nasal congestion, or other concerning symptoms, it's always best to consult with your doctor. They will be able to examine you, ask about your symptoms, and determine the best course of action. Don't let another day go by without feeling your best. Breathe easy and live fully. Symptoms of a deviated septum include difficulty breathing through the nose, frequent infections, and a chronic cough. Allergies are the most common cause of nasal congestion. Symptoms like sneezing, itching, and a runny nose often accompany it. First, you can try to identify and avoid the triggers that are causing your allergies. Over-the-counter antihistamines or nasal corticosteroids can also be effective in reducing inflammation and relieving congestion. For a cold, you can try using a saline nasal spray or rinse to help thin the mucus and improve your symptoms. In some cases, your doctor may prescribe you a decongestant or an antihistamine to help relieve your nasal congestion. A cold can also cause similar symptoms, and in some cases, a person may develop a thick mucus or a nasal discharge. Well, in this video, we will discuss the reasons why you may be breathing through one nostril and whether it should be a cause for concern. Nostril breathing is a natural reflex that helps to warm, humidify, and filter the air you breathe. Normally, you breathe through both nostrils equally. However, several factors can cause you to breathe through only one nostril, such as a stuffy nose due to allergies or a deviated septum. Now, when it comes to breathing through only one nostril, it's essential to first identify the underlying cause. On the other hand, a deviated septum can be a more serious issue. So what can you do if you're breathing through only one nostril because of a stuffy nose or allergies? However, if you're experiencing difficulty breathing through your nose because of a deviated septum, then surgery may be an option to correct the problem. In conclusion, breathing through one nostril can be a normal physiological response or a sign of something more serious, such as a deviated septum.